It's my feel-good breakfast show.
Welcome back to it, your feel-good breakfast show, Expresso here on SABC3 on a Tuesday morning. Now, last week, South Africa started with its vaccination program after the first 80,000 doses of the Johnson & Johnson vaccine landed in the country from Belgium. All the excitement around that. Now, the vaccination program forms part of the vaccine rollout implementation study that has been approved for use in the country. And President Cyril Ramaphosa and healthcare workers across the country were the first people to receive the COVID-19 vaccine. Infectious Diseases Specialist, Dr. Emile Reid, is back to give us a COVID-19 update so we know what's going on in that world. Dr. Emile, good morning.
Good morning.
Doctor,
good morning, guys.
As Tabiso mentioned, there's so much excitement. I think it gives us a sense of hope. But we're going to start off with the current statistics in South Africa. How many increases have there been, or is it decreasing in terms of the rates of COVID-19 infections?
Well, we're actually so happy because yesterday was the first 24 hours we had less than 1,000 cases. I mean, that's amazing. Beautiful. So we're going through a lull with regards to COVID cases at the moment. Hospitals filling up with regular cases, neglected cases, especially in the last few months. People didn't want to come to hospitals, don't want to go there because they're scared of contracting COVID. So we're actually seeing a lot of normal neglected cases at the moment. So currently in the Western Cape, we're sitting with around about 7,000 active cases, and only KZN, which is sitting at around about 13 or 15,000 active cases at the moment. So we're way down. And taking a break from COVID-19 at the moment.
Which is a relief, right?
Yes.
It does really bring a sense of relief. I think we've all been very stressed and very stretched. And I think especially the healthcare workers, the frontline workers have really had it hard. But the vaccine is here now. Even though we've only got 80,000 that were delivered, let's talk about the Johnson & Johnson vaccine. How long will it last?
Well, it's a fantastic vaccine. And currently people consider it still to be a trial of the vaccine, but it isn't. I mean, the trials were already conducted last year in South America, in the UK, and also in South Africa. So we would like to call it a phase 3B open label study. And it means that everybody is getting the active vaccine and not a placebo group at all. So everybody's getting the vaccine. And the only reason why it's called a trial that is done by Sisonke, which means together, is because we will probably only get full authorization towards the end of March, beginning of April, from SAPRA, which is the South African Health and Product Regulatory Authority in South Africa. And currently we are vaccinating doctors and frontline healthcare professionals with this vaccine. And I was happy to receive my vaccine yesterday. So I'm fully vaccinated.
Is that why you put a hello this morning?
And that's why I've got this smile about me today. So I'm very blessed to have received the jab. And so are many of my colleagues. And currently, around about 24,000 healthcare professionals have been vaccinated in the last 3 to 4 days.
We're moving fast.
Yes, and I love that. That's what we need. I'm pretty sure you at home have questions right now about the COVID-19 updates. Make sure to hit us up on 021-110-5552. Dr. Emile Reid is still in the studio to answer all of your questions live. Doctor, you just mentioned that you received your jab yesterday.
Yes.
What are some of the side effects that have been, tested when it comes to the Johnson & Johnson vaccine?
Well, I think everybody needs to understand that whatever vaccine you get, you will always have some form of side effects. It's mild, It can cause a tingling feeling in your arm.
Yeah.
You might feel a little bit of headache.
Yeah.
You might feel a little bit of muscle ache.
Yeah.
The important thing about that, if you get it, you must actually say yes. And what it means, that it's actually stimulating and priming your immune system to fight COVID-19 and fight the virus whenever you get exposed to this particular virus.
Well, we've come a long way from the time that the COVID-19 pandemic sort of broke to the time that we're sitting at now, where researchers have worked around the clock to come out with this vaccine. And to have this vaccine arrive in South Africa, even at a small number like that, is really so encouraging. And we really cannot wait to see that roll out. But we do encourage you to get in touch with us. Any questions you have about the vaccine and how it's going to be rolled out, the side effects, and all the many other things that you might have read about it on, the papers or have heard in the news. Getting in touch with us is what you need to do. 021 110 5552 or our Facebook page, Expresso Morning Show, SABC3.